for an excision of a pilonidal.
Yes.
Yeah. So if you understood it as well, yeah, you could start to speak, because this card is it is a conversation taking place between the nurse and the patient. It is a general practice, and your patient is 26 years old, and she has got this kind of problem like pilonidal cyst or sinus. But she is quite hesitant and embarrassed to speak about a problem, and she is hesitating to discuss. So you have to gain her confidence, and you have to encourage her, and you have to help her to understand what is this pilonidal cyst, and how the sinus could be removed, and what all the do's and don'ts and precautionary measures to be followed. Okay.
Okay.
Right.
Good morning. I am Padmaja here. Can I know your name, please?
Yeah, good evening. See, always you stick on to the time, okay? Because the time is why I'm telling you to use the time, so that when the exam is happening correctly, you can stick on to the same time. You should not, because now evening you're speaking, because we don't know, even your speaking time could be 7 o'clock in the evening, right?
Yes.
So always stick on to the time. Right. Could you start it again?
Yes. Good evening. I am Padmaja, your nurse. Can I know your name, please?
Good evening, Nurse Padmaja. My name is Sarah. I'm 26 years old, and I hope you might be aware of the reason for what I've dropped over here. Otherwise, let me give an introduction that I think I'm suffering from this pilonidal cyst. I'm quite embarrassed to speak on this. I don't know, why do I get this problem? It's quite disgusting, even to medical team to discuss what is my problem. I don't understand, how do I get this problem, nurse? Can you please help me out, and also let me know what is this excision and what is the procedure?
Well, Sarah, your concern I can understand. I would like to explain you. It is nothing but pilonidal cyst is sinus is just a small opening which occurs due to the hair which gets infected, and like it is little pressure over that, and it usually means some or the other time majority of us we face this problem. This is nothing but an ingrown hair which exacerbate due to the sweating, and maybe it gets inflamed, and that is how you may feel little maybe where the portion of the skin gets little pressure or stressed out, or maybe like it may get trapped into a cloth while sitting or sometimes. So nothing to worry. I can understand your concern because you are a female and the pilonidal cyst is present in such an area where you cannot even share. But I would like to know, what do you do for this, and since when you have got this problem?
That's what, nurse. I just dropped over you. I don't know how to handle the situation, and moreover, I want to inform you that I'm a person who is giving more importance to cleanliness. I take bath twice a day and wear neat and clean clothes. But I was told by one of my colleagues that pilonidal cyst is mainly because of unhygienic habits or non-cleanliness. I wonder, how do I get this? Because I give more importance to cleanliness. And moreover, yes, as you say, that pressurized, the pressure that has been given on the sitting posture, that is, as I sit for a long time, yes, my job is, I'm an accountant. I work 9 to 5, so I have to sit continuously. So I'm afraid, so what is, in what way I could protect myself, though incision has been done. Further, how could I protect? It should not occur to me again.
Well, Sarah, what you said is that it is not an indication of uncleanliness or unhygienic practices which the people do it. It is nothing like that, not to worry. Well, if you have got to hear that, but you don't have to worry. Even the people, those who are well hygienic or they maintain their hygiene, it may occur because, as you said, that you are an accountant and your job is mostly a sitting job. So maybe for 9 to 5 majority time or most of the hours you sit, and there are chances that you may sweat, and because of that sweating this may have happened, but not to worry. Yeah, definitely this problem will be resolved with the proper treatment. And I hope that as your documents have come here and the doctor have advised you to undergo a surgery, a minor surgery, which will be just removed, and the packing of that sinus will be done with the antiseptic medications, and it will recover within a week or two, and you will be all right. So you don't have to worry that, but you have to definitely take care of your health in future, as you said, how you can prevent it. So I would like
Yeah,
to tell you that.
that's my concern now. So because I already told that this is my nature of job and I could not change my job, right? And so after the excision, the surgery, again I have to continue the same job. So if you give me some more, tips, the health, healthy habits or some change in my habits which could help me to, prevent it in the future and, to protect myself, that could be far better.
Well, Sarah, as I can understand your concern for the reoccurrence of this sinus, but not to worry. Initially, after a surgery, you may have to take more care, as this may there are chances of bleeding or some signs of infection, because it's an open wound where you need to take care to prevent the infection, as well as whatever the medications are prescribed by the doctor, you have to take it. But in future, what you can do is I can give you some tips. Firstly, once you recover from this problem, you can continue your job. You don't have to leave your job. Secondly, what you can do is, as you are doing your sitting job most of the hours, in between you can just get up and just have a 2 minutes walk. Third one is like, what you can do is you have to wear a soft cotton clothes where you can means if there is a sweating also, it will absorb the sweat. And one more thing, what you can do is, if possible, you can apply a or a dust powder where it will reduce the friction of the skin and the cloth, between the skin and the cloth. So it will help you to be free from this problem in future. I hope you must have understood.
Well, exactly, no. It's a proper information that you had given me how to handle the situation. I'm really thankful to you. Yes, as you told that, no, the procedure is simple. And one more question to me after this incision. How much time would it take for me to get back into my job? Because I could not be on prolonged leave, hardly 1 or 2 days. I could take leave.
Well, Sarah, if you take proper care of your wound after surgery or after this excision, it may take hardly 3 to 4 days, or maybe within 2 days. But I think that you should take rest for 7 days, so that you will be perfectly all right.
Well, and one more question. I'm quite inquisitive to know a lot of things because this is something which is quite nagging my mind. Say, for example, once I start to get back into my job, do I stink? Will there be any kind of foul smell, or do I bleed? How could I, handle it in my workplace?
Well, Sarah, I don't think that you have to go for a job immediately. Maybe within 2 to 3 days, this bleeding and infection. If there is no sign of infection, it won't bleed. And as you said, if there is a pus, but I don't think that if you take a proper medication, there will be a pus formation. So definitely, pus and bleeding won't be there. But see to it that the wound doesn't remain open or get infected. If it gets infected, or if you feel that there is a pus discharge from the wound, you can have a proper dressing, and in between you can have a change of your inner garment, so that it will be much helpful for you.
Yeah.
I
So
hope, yes.
yes, thank you so much, Nurse, for the clarity that has been given from your side. Thank you so much. Definitely, I do follow the instructions, given from your side. And if there is any kind of discomfort, I would contact you. Thank you.
Well, Sarah, welcome.
Yeah, nicely spoken, Padmaja. See, I'm doing for more lot of students immediately. I'm getting, no, I'm not getting the name. Just now I have
No
done,
problem.
yeah, I've done for a student. Her name is Vinci. She is going to face her exam on 1st of February, the same card. Okay. So immediately Vinci, that name is coming to me. Fine, Padmaja. So very well spoken. I'm giving you grade B for this. Well spoken. But initially, you had repeated the same information, so first and second. See, one point that you have missed, actually, it is your responsibility to check with the patient what she does, is she working, what is the nature of job, because this is something with regard to pilonidal sinus or cyst. Definitely, it is something that occur in the buttocks, in the cleft, because of prolonged sitting or accumulated stressful situation, or accumulated what we call as the sweat, because of prolonged sitting. Sometimes yes, the non-cleanliness, and that also could be one of the reasons that we could not rule out. But here, what is the main reason? That it is your responsibility to check with the patient. So in the second dialogue, you have to check with the patient. Yes, Sarah, I just like to know that what is your nature of job? What do you do? And what is your habit, food habit, and other habits. So if you say that, that could be really helpful for me to assess what could be the reason for the pilonidal sinus. As you told that you are giving more importance to cleanliness. Let me assess what other reasons could be. So you have to check. No, that question you should have asked.
Yes.
But as you
Yes.
missed it, so I myself, I told you that so I'm working as an accountant, and I have to sit continuously for 9 to 5. No, this is my work time. Prolonged sitting I'm into. So in case what is the guarantee that it won't recur? What should I do to prevent or protect myself? So I asked it. So it is your responsibility. If you'd have asked, then I would have told what is that. Okay, and next to that, you were hesitating to speak clearly, because always the patient is a lay person, like that common man, simple information you could give. So you could say that rather hesitating, because as you are in the medical team, you should not hesitate to speak what is what. So clearly you could say that pilonidal cyst, yes, I know, I do understand. Why do you hesitate to speak? Because it is a kind of small boil, or it is a kind of pimple, like that is occurring in the private part, especially mainly because of prolonged sitting and sweating, and people who are into gym and more of exercise. And not only that, yes, cleanliness also plays a very important role. Unhygienic lifestyle if you lead, that could also be one of the reasons, because of the hair follicles, right? And some kind of ingrown hair growth, especially in the in that is actually in the buttocks, in the cleft only it occurs mainly. You said because of the clot might have struck. So more than that, you can give the correct information like this. Okay. So you should not hesitate to say what is it, because the patient asked, I don't understand what is this pilonidal cyst and how did I get, because my colleague told that because of this reason, unhygienic habit. But I'm a person, I take twice a day bath, and I wear neat and clean clothes, and that's why I'm really embarrassed to speak on this. So you have to make the patient come out of the confusion, and that is the right question.